For 6 months, everyone at St. Catherine's Memorial Hospital laughed at Nurse Clara Bennett. They laughed when she walked too quietly through the emergency ward, as if afraid her shoes might offend the polished floor. They laughed when she double-checked patient charts, even after the doctors had already signed them. They laughed when she spoke softly to crying children, elderly patients, angry relatives, and even the hospital's stray cat that sometimes slipped through the ambulance bay doors, looking for warmth. To them, Clara was not impressive. She was not loud. She was not sharp-tongued. She did not rush around pretending to be important. She never argued back when insulted. And in a hospital where confidence was often mistaken for competence, Clara's silence made people believe she had nothing worth saying. "Careful," Nurse Denise Palmer whispered one morning as Clara entered the break room with a tray of medication cups. "Here comes the walking apology." The other two nurses at the counter laughed into their coffee. Clara heard them. Of course she heard them. She always heard them. She placed the tray down gently, checked the labels again, and said nothing. Denise leaned back against the counter, folding her arms. "Clara, sweetheart, you know the meds are already checked by pharmacy, right? You don't have to stare at them like they're going to start speaking." Another nurse smirked. Maybe they speak her language. Slow and nervous. More laughter. Clara kept her face calm. She had learned long ago that people who wanted a reaction were usually disappointed by silence. She adjusted the tray, confirmed the patient names, and prepared to leave. Before she could reach the door, Dr. Marcus Hale walked in. He was the kind of doctor everyone noticed immediately. Tall, polished, confident, with a voice that filled every hallway before he even entered it. He had been chief of emergency medicine for 3 years, and he wore the title like armor. "Bennett," he said, glancing at her tray. "Please tell me you are not still rechecking routine medication." Clara turned. "I noticed Mr. Harris's blood pressure was lower than usual this morning. I wanted to make sure the dosage was still appropriate before administration." Dr. Hale sighed loudly, as if her sentence had wasted hospital oxygen. "Mr. Harris is stable," he said. "The order stands." "I understand," Clara replied. "I just thought it was worth reviewing." Denise made a small coughing sound that sounded suspiciously like a laugh. Dr. Hale stepped closer. "Nurse Bennett, emergency medicine requires speed, confidence, judgment. You cannot hesitate over every tiny detail." Clara met his eyes, but only for a second. "Yes, doctor." "That is exactly the problem," he said. "You always say yes, but you never seem sure." The room went quiet in that cruel way. Rooms go quiet when everyone wants to hear the insult clearly. Clara nodded once. "I'll administer the medications." Dr. Hale moved past her, already done with the conversation. As Clara left the break room, she heard Denise whisper behind her, "Honestly, how did she even get assigned to emergency?" Another voice answered, "Probably felt sorry for her." The laughter followed Clara into the hallway. She walked past the nurse's station, past the swinging ER doors, past the row of chairs where worried families waited with tired eyes and folded hands. Her face remained still, but her fingers tightened around the tray. No one at St. Catherine's knew much about Clara Bennett. They knew she was 34. They knew she lived alone. They knew she had transferred from a small veterans clinic outside the city. They knew she never came to staff parties, never posted photos with coworkers, never talked about her past. And because they knew so little, they filled the empty spaces with whatever made them feel superior. She probably couldn't handle a real trauma unit. She looks like she'd faint at the first serious emergency. She's too soft. She's too quiet. She's useless. Clara had heard every word. But what they did not know was that silence had once kept her alive. Years before she walked the clean white halls of St. Catherine's, Clara had worked in places where there were no polished floors, no coffee machines, no comfortable break rooms, and no doctors making speeches under fluorescent lights. She had learned to listen for breathing in chaos. She had learned to read fear in a soldier's eyes before he spoke. She had learned that panic could spread faster than infection, and that the calmest person in the room often had the most control. But she never told anyone that. Some stories were not meant for people who only wanted gossip. That afternoon, the emergency department was unusually busy. A construction worker had come in with a crushed hand. A teenager had fainted during basketball practice. An elderly woman was complaining of chest tightness. 2 paramedics were arguing at the nurse's station about bed space. Clara moved from patient to patient, quiet and steady. In room 4, she noticed the elderly woman's lips had lost color before the heart monitor showed anything unusual. Clara alerted the team, adjusted the oxygen, and prepared the necessary equipment before Dr. Hale arrived. He barely looked at her. "Good catch," one junior resident muttered under his breath. Dr. Hale glanced at him. "That is basic observation, Dr. Kim. Let's not throw a parade." Clara stepped back and let them work. In room 7, she calmed the teenage boy who was trembling with embarrassment after fainting in front of his teammates. "You're not weak," she told him gently, while placing a cool cloth on his forehead. "Bodies send warning signals. Smart people listen before things get worse." He looked at her, eyes watery. Everyone laughed. Clara paused for half a second, then she said, "People laugh when they don't understand. That doesn't make them right." The boy nodded, holding on to those words as if they had been written for him. Maybe they had. By 5 in the evening, the sky outside had turned a dull gray. Rain tapped lightly against the ambulance bay windows. The hospital lights reflected on the wet pavement, blurring red and white into long streaks. Clara was restocking trauma supplies when Denise appeared beside her with a clipboard. "Dr. Hale wants you on discharge paperwork for the rest of the shift," Denise said. Clara looked up. "I'm assigned to trauma rotation today." "Not anymore." Denise smiled without warmth. "He said things are moving fast tonight. We need people who can keep up." Clara absorbed the words without flinching. "I can keep up," she said quietly. Denise laughed. "Clara, you move like you're afraid the air might bruise." A young nurse passing by snorted. Clara returned her gaze to the supply drawer. Gauze, tape IV start kits, saline flushes. She counted them carefully. Denise tilted her head. "You know, it wouldn't hurt you to admit emergency just isn't your place. Some people are made for pressure. Some people are made for paperwork." Clara closed the drawer. For one brief moment, something changed in her expression. It was small, almost invisible, but Denise noticed enough to stop smiling. Clara said, "Pressure doesn't always look loud." Denise blinked. "What?" Before Clara could answer, the ambulance bay doors burst open. A security guard ran inside first, soaked from the rain, his radio crackling against his shoulder. "We need help at the bay," he shouted. Now, every head in the ER turned. 2 military police officers rushed in behind him. Their uniforms were wet, their faces tense. One of them had blood on his sleeve, but he was not the one being carried. A deep, furious bark exploded from outside. The sound froze the hallway. It was not the bark of an ordinary frightened dog. It was sharp, commanding, broken by pain, but still powerful enough to make people step back. Another bark followed. Then the metallic crash of something hitting the ambulance doors. "What is that?" Denise whispered. Dr. Hale came out of room 4, pulling off his gloves. "Report." One of the military officers spoke quickly. Military working dog. Male Belgian Malinois. Names Ranger. Injured during a training transport accident. Handler is unconscious and being treated at County General. The dog refused separation. We had to bring him here because this was the closest emergency facility with surgical support. Dr. Hale frowned. This is not a veterinary hospital. We know that, the officer said. Animal trauma unit is 40 minutes away. He may not have 40 minutes. Another violent bark shook the bay. A paramedic stumbled backward through the doors, face pale. He won't let anyone near him, the second officer added. He's trained for combat response. He's scared, injured, and still guarding. We tried commands, but he's not listening. The ER staff crowded near the doors, curiosity mixing with fear. Dr. Hale straightened his coat. Sedate him. The officer shook his head. We can't get close enough. He snaps at anyone who approaches. Then use a catch pole. He'll fight it. He's already hurt. If he panics harder, we could lose him. A strange silence settled over the emergency department. The laughter from earlier was gone. Through the rain-streaked glass, Clara saw him. Ranger stood inside the ambulance bay, his body low, trembling from pain and fear. His tan and black coat was wet. One leg barely carried weight. His ears were pinned back, but his eyes were alert, scanning every movement, every hand, every face. 3 grown men stood around him, and none dared move closer. A young medic held a towel in shaking hands. The dog growled, not wild, not vicious, worn. Clara knew the difference. She stepped closer to the glass. Her heart did not race. Her hands did not shake. The noise of the hospital faded into something distant. All she saw was the dog, the way his eyes kept moving to the left, the way his breathing hitched between growls, the way he protected one side of his body, the way he waited for a voice that was not there. Denise noticed Clara staring and gave a nervous laugh. Don't tell me you're going to whisper nice things to him. A few staff members chuckled, but weakly this time. Dr. Hale turned sharply. Everyone stay back. Security, clear the bay entrance. Clara stepped forward. I can try, she said. The hallway went still. Then Denise burst out laughing. You? She said. Clara, he'll eat you alive. One of the residents looked uncomfortable. Maybe we should wait for animal control. Clara did not look at them. She looked at Ranger. Dr. Hale's expression hardened. Absolutely not. Nurse Bennett, step away. Clara turned to him calmly. If you rush him with force, he'll fight. If he fights, his condition may worsen. He is not attacking because he wants to. He is guarding because he doesn't know who is safe. Dr. Hale stared at her. And you know this because you talk to stray cats? A few people laughed again. Clara looked back through the glass. Ranger's growl deepened as another medic tried to shift position. She spoke more quietly now, but every word was steady. No, she said. I know because he's waiting for the kind of command that tells him the mission is over. The military officer nearest her turned his head. His eyes narrowed, not in mockery, but recognition. Clara took one step toward the ambulance bay doors. Dr. Hale reached out as if to stop her. Bennett. She paused with her hand on the door. For the first time since anyone at St. Catherine's had known her, Clara's voice carried through the entire emergency ward. Get me a trauma kit, 2 large towels, saline, and no sudden movements. No one moved. They were too shocked to hear her give an order. Then Ranger barked again, a desperate sound that echoed against the glass. Clara opened the door and stepped into the rain-cooled bay behind her. The same people who had laughed at her all day stood frozen. And for the first time, not one of them was laughing. The ambulance bay felt colder than the rest of the hospital. Rainwater ran in thin streams across the concrete floor. Red emergency lights flashed against the walls. Somewhere behind Clara, The automatic doors whispered shut, cutting off the noise of the crowded DR. For a few seconds, all she could hear was Ranger breathing. The Belgian Malinois stood near the open ambulance, body tense, head low, eyes sharp. His injured leg trembled beneath him, but he refused to lie down. Every time someone shifted even slightly, his lips pulled back and a warning growl rolled from his chest. The military police officers stood several feet away, frozen between fear and duty. One of them whispered, "Mom, please don't move too fast." Clara did not answer. She already knew. Fast movements meant threat. Loud voices meant threat. Hands reaching down from above meant threat. Crowding him meant threat. To everyone else, Ranger looked dangerous. To Clara, he looked terrified. She lowered herself slowly, not kneeling completely, just enough to make her body smaller. She turned slightly sideways so she was not facing him directly. She kept her hands visible but relaxed, palms open, fingers loose, behind the glass doors. The staff watched. Denise stood near the front, arms folded tight against her chest. Dr. Hale was beside her, jaw locked, ready to prove this was a mistake. "Someone stop her," one nurse whispered. "No," the military officer said quietly. "Wait." Clara took one small step. Ranger growled harder. She stopped immediately. "That's it," she said softly. "I hear you." His ears twitched. The growl did not stop, but it changed. It became lower, less explosive. Clara's eyes moved over him without staring too long. His breathing was uneven. His right side was guarded. The towel one medic had tried to place near him lay abandoned on the floor. There were dark marks on his harness and around his front leg, but Clara did not let her eyes stay there. She needed to see the whole picture, not panic over one detail. "Ranger," she said. The dog's eyes snapped to hers. The officer behind her inhaled sharply. "He knows his name." Clara nodded once, still watching the dog. "Of course he does." She lowered her voice further, shaping each word with calm authority. "Ranger, easy." The dog did not relax, but he listened. That was enough. Inside the ER, Denise gave a nervous laugh. "She's going to get bitten." Dr. Hale said nothing. Clara shifted her weight slowly and reached into her pocket. Not for equipment, not for anything sharp, just a small pair of clean gloves. She placed them on the floor in front of her, showing Ranger that her hands were empty again. "I'm not taking your mission," she whispered. "I'm not taking your handler. I'm here for you." The dog's eyes flickered Hather. That word meant something. The younger military officer stepped closer by mistake. Ranger barked so violently that the officer jumped back. Clara lifted one hand without turning around. "No one moves." The authority in her voice cut through the bay. The officer froze. Through the glass, several nurses exchanged stunned looks. Clara did not sound like the woman they had mocked in the break room. She did not sound nervous. She did not sound unsure. Her voice was quiet, but it carried weight, like someone who had once given instructions when noise, fear, and time were all working against her. She took another slow step. Ranger's growl returned, but weaker now. He was watching her hands. "Good," Clara said. "Watch me. That's good." She lowered herself another inch. Her knees ached from the cold floor, but she ignored it. "Ranger," she said again. "Stand down." The dog went still. Behind her, one of the officers whispered, "What did you say?" Clara did not repeat herself for him. She repeated it for Ranger. "Stand down." The dog's ears lifted slightly. His eyes stayed locked on her face. The growl faded, not completely, but enough. Clara breathed once, slow and controlled. "Good boy," she said. But there was no sweetness in it, no babying, no pity. It was respect. Soldier to soldier, worker to worker, survivor to survivor. Ranger shifted his weight, then winced. Clara saw it immediately. There was less time than the others understood. "Trauma kit," she called without looking back. No one answered. She turned her head slightly toward the glass doors. "Now." The junior resident, Dr. Kim, startled as if he had been caught sleeping. He grabbed the kit from a nearby cart and rushed it toward the bay entrance, then stopped, unsure how close he could come. "Slide it," Clara said. He pushed the kit gently across the floor. It stopped 2 feet short of her. Ranger watched it, but did not bark. Clara picked it up slowly. The dog's body tensed. She froze again. "Easy," she murmured. "You're still in charge."
That to matter?
She opened the kit carefully, one latch at a time, making sure each click was soft. Then she pulled out gauze, saline, and bandaging supplies. Dr. Hale stepped into the bay behind her, keeping distance but unable to stay away any longer. "Nurse Bennett," he said, low and sharp, "do not attempt anything beyond your scope." Clara did not turn around. "Then tell me who in this bay has control of the patient," she said. Dr. Hale opened his mouth. No answer came. Ranger's eyes remained on Clara. His breathing was getting faster. His injured leg shook again. Clara spoke calmly. "He needs pressure control and stabilization before transport. If we wait for another team, we may lose the chance to move him safely." Dr. Hale looked at the military officers. "Can anyone confirm his handler's commands?" The older officer looked pale. "His handler is unconscious. We only know basic obedience commands." Clara finally glanced back. "Then let me work." The words were not loud. They did not need to be. Dr. Hale's face tightened, but he stepped back. Clara turned to Ranger again. "Ranger," she said. "Down." For a moment, nothing happened. Then the dog slowly lowered his body, 1 inch, then another. His front leg trembled so badly, Clara wanted to reach forward and support him. But she forced herself not to rush. Trust was a bridge. One wrong step could break it. Finally. Ranger lay down with his head raised, still alert, still guarding, but no longer ready to lunge. Behind the glass, the ER staff fell completely silent. D-Nice's mouth had opened slightly. Clara moved closer until she was within arm's reach. Ranger watched every inch of movement. She placed one towel beside him, not on him. He sniffed it. She waited then, slowly. She touched the edge of his harness. Ranger growled once. Clara stopped. "Fair," she whispered. "You warned me." She moved her hand away and gave him a second. Then she tried again, this time touching the strap lower, away from the most painful area. Ranger's breathing hitched, but he allowed it. "Good," Clara said. "Very good." She worked fast after that, but not rushed. There was a difference. Her hands moved with clean precision. She checked his breathing, his gum color, his pulse, and the position of his injured leg. She used the towel to control the bleeding enough to stabilize him, then wrapped the area firmly without causing unnecessary movement. Dr. Kim stepped closer, eyes wide. "How do you know how to do that?" Clara kept working. "Hold the saline ready." He obeyed immediately. The word obeyed would have shocked him if he had thought about it. 10 minutes earlier, he had watched everyone treat Clara like a nervous extra body in the ER. Now his hands moved because she told them to. "Not too close," Clara said. "Put it there." Dr. Kim placed the saline where she indicated. Ranger's eyes followed him. Clara touched the dog's neck gently. "He's helping. Leave him." The dog stayed down. The military officers looked at each other. Something changed in the room then. It was not dramatic. No music swelled, no one clapped, but the balance shifted. The people who had been in charge were now watching the woman they had dismissed. Clara noticed Ranger's breathing pattern change again. His chest rose too quickly, then paused. Her face sharpened. "Dr. Hale," she said. He stepped forward despite himself. "What?" "He's compensating." We need to move him carefully, right side supported. No crowding, no raised voices, no metal clatter. Dr. Hale looked at the dog, then at her hands, then at the bandage. He was seeing the same signs now, but she had seen them first. "Get stretcher board," he ordered. Clara's voice cut in. "Soft padding first. He'll panic if the board slides under him cold." Dr. Hale stopped. For a second, everyone saw it. The chief of emergency medicine had been corrected by the quiet nurse, and he did not argue. "Soft padding," he said. Denise rushed to grab it, then paused as if realizing she had just followed Clara's instruction through Dr. Hale's mouth. Clara kept one hand near Ranger's shoulder, not holding him down, just grounding him. "You're doing good," she said softly. "Mission's not over, just changing hands." Ranger blinked slowly. For the first time, his head lowered to the towel. A breath passed through the bay. The older military officer swallowed hard. He hasn't done that since the accident. Clara did not look up. "He was waiting for permission to stop fighting," she said. No one laughed. Not Denise, not the residents, not the security guards, not even Dr. Hale. They moved Ranger together under Clara's direction. Every motion was slow and coordinated. Clara told them when to pause, when to shift, when to lower their hands. Ranger growled once when the board touched his side, but Clara leaned close and repeated the same command. "Stand down." His body trembled. Then he obeyed. Within minutes, the dog, who had kept an entire emergency department frozen, was stabilized enough to move. Dr. Hale looked at the clock on the wall. 7 minutes had passed since Clara stepped into the bay. 7 minutes. That was all it took for the walking apology to do what trained officers, medics, doctors, and security could not. As they rolled Ranger toward the emergency treatment room, the staff parted automatically. Clara walked beside him, one hand resting lightly near his harness. Denise stood near the nurse's station. Holding the padding she had fetched too late to matter. Her face had lost all its color. Clara passed her without looking. But Ranger did. The dog lifted his head just enough to stare at Denise with tired, watchful eyes. Denise took a step back. No one spoke. In the treatment room, Dr. Hale pulled on fresh gloves. "All right, we continue stabilization until veterinary trauma arrives. Dr. Kim, monitor vitals. Bennett, you stay with the dog." Clara looked at him. For the first time all day, he did not call her slow. He did not call her hesitant. He did not tell her to do paperwork. He said, "He trusts you." Clara gave a small nod. Ranger's breathing steadied beneath her hand. Outside the room, the story had already begun spreading through the hospital. The quiet nurse had walked into the bay. The military dog had listened. The bleeding had been controlled. The crisis had changed in minutes. And every person who had laughed at Clara Bennett that morning was now trying to remember exactly what they had said. By the time Ranger was moved into the emergency treatment room, the whole hospital seemed to be holding its breath. No one was laughing now. Not Denise, who stood near the doorway, with her clipboard pressed against her chest. Not the young nurses who had whispered jokes in the break room. Not even Dr. Hale, who kept glancing at Clara as if he was looking at a person he had never truly seen before. Ranger lay on the padded table, still alert but calmer now. His eyes followed Clara's every movement. Whenever another nurse stepped too close, his body tensed. Whenever Clara touched his shoulder and whispered, "Easy," he settled again. Dr. Kim monitored the equipment, his face serious. "Vitals are improving." Clara nodded. "Keep the room quiet. No sudden sounds." Denise stepped forward carefully. "Do you need another towel?" Clara looked at her for a moment. Denise's face turned red, as if she remembered every cruel word she had said that morning. "Yes," Clara said softly. "Thank you." Those two words seemed to hit Denise harder than anger would have. She quickly handed over the towel and stepped back. Dr. Hale cleared his throat. Veterinary trauma team is 12 minutes out. 12 minutes is enough if we keep him stable, Clara said. Dr. Hale did not challenge her this time. That silence said more than an apology. Clara worked with calm precision, guiding the team through each step. She did not panic. She did not raise her voice. She noticed every change in Ranger's breathing, every flicker of fear in his eyes, every small sign that he was slipping back into distress. The same staff who had once called her slow now waited for her instructions. Lower the light. Someone lowered it. Move that tray away. The metal sound will scare him. Someone moved it. Dr. Kim, keep your hand where he can see it before you check. Dr. Kim obeyed. Ranger watched them all, but he trusted only one person. Clara. 7 minutes had made the hospital silent. 20 minutes had made it ashamed. When the veterinary trauma team finally arrived, they entered quickly, carrying their own equipment. The lead veterinarian, a woman named Dr. Reyes, stopped at the doorway when she saw Ranger lying calmly beside Clara. Her eyebrows rose. This is the K9 who wouldn't let anyone within 6 feet. The older military officer nodded. Yes, Mom. Dr. Reyes looked at Clara. How did you get him down? Clara removed her gloves slowly. He was scared, not aggressive. Dr. Reyes studied her for a second, then looked at the bandaging, the positioning, the way Ranger had been kept calm without restraint. This was good work, she said. Very good work. Dr. Hale looked at Clara. The words had come from someone outside his authority, someone with no reason to protect Clara's feelings. He had no excuse now, no way to call it luck, no way to dismiss it as basic observation. The veterinarian and her team prepared Ranger for transfer. When they tried to move him, he lifted his head and gave a low warning sound. Clara leaned close. Ranger, she whispered. Stand down. The dog relaxed. Everyone in the room saw it. Dr. Reyes paused. That command is usually used by military handlers. The older officer turned toward Clara. His face had changed. He had been staring at her for several minutes now, not with suspicion, but with memory. What did you say your name was? He asked. Clara's hands stilled for the first time. Clara Bennett. The officer's eyes widened slightly. Bennett? He repeated. Nurse Bennett? The room went quiet. Clara looked down at Ranger. The officer stepped closer, his voice softer now. Were you attached to the 27th Medical Response Unit? Clara did not answer immediately, but the silence answered for her. Dr. Kim looked from the officer to Clara. Denise's mouth parted. Dr. Hale stood completely still. The officer swallowed. I heard about you. Clara finally looked at him. That was a long time ago. No, he said. People still talk about it. Dr. Hale frowned. Talk about what? The officer turned to him, but his eyes stayed respectful toward Clara. Years ago, during a military rescue operation, a medical unit was hit hard. Soldiers were injured. A K9 team was trapped. Most people couldn't get close because the dog was guarding his handler. He paused. A nurse walked in alone, calmed the dog, treated the handler, and helped bring them both out alive. No one moved, the officer continued. That nurse was Clara Bennett. Denise lowered her eyes. Dr. Kim stared at Clara like the floor had shifted beneath him. Dr. Hale's expression changed slowly, first confusion, then disbelief, then something close to shame. Clara's voice was quiet. I did my job. The officer shook his head. You did more than that. Clara looked away. Some people came home. Some didn't. That sentence ended the questions. Even Dr. Hale, who always had something to say, said nothing. For the first time, the staff understood that Clara's silence was not weakness. It was history. It was grief. It was discipline. It was the kind of strength that did not need applause to exist. Ranger was prepared for transfer to the Veterinary Trauma Center. Before they wheeled him out, the dog lifted his head again. He looked at Clara. Dr. Reyes smiled gently. I think he wants permission. Clara stepped close and placed her hand lightly near his harness. You're safe now, she said. Mission complete. Ranger's eyes softened. Then, with the little strength he had, he pressed his head against her hand. The room broke, not loudly. Not with cheers, just with quiet emotion. Dr. Kim turned away and wiped his eyes quickly. One of the nurses covered her mouth. Denise stared at the floor, tears forming despite her effort to hide them. The military officers stood straighter, as if Clara had earned a salute without asking for one. As Ranger was rolled out, his eyes stayed on Clara until the doors closed behind him. Only then did Clara step back. The emergency room remained silent around her. Dr. Hale removed his gloves and approached slowly. Nurse Bennett, he said. She looked at him. For once, his voice had no arrogance in it. I owe you an apology. The entire staff listened. He continued. I misjudged you. I dismissed your caution as hesitation. I treated your calmness as weakness. I was wrong. Clara did not smile. She did not celebrate. She simply held his gaze. Yes, she said. You were. The honesty of it struck him harder than anger. Denise stepped forward next, tears now visible. Clara, I'm sorry. For what I said today. For what I've been saying for months. The other nurses looked ashamed. One by one, small apologies followed. I'm sorry. We shouldn't have laughed. You didn't deserve that. We were wrong. Clara listened to all of them. Then she said, You don't have to understand someone's past to treat them with respect. No one answered. Because everyone knew she was right. The next morning, St. Catherine's Memorial Hospital felt different. The same lights shone over the same halls. The same monitors beeped. The same patients waited behind curtains and doors. But when Clara walked in, nobody whispered. Denise looked up from the nurse's station. Morning, Clara. Not Bennett, not walking apology. Not paperwork nurse, Clara. Dr. Kim handed her a chart. Can you review this with me? I think I may be missing something. Clara took it and nodded. Of course. Across the room, Dr. Hale watched quietly. He did not interrupt. He did not correct. He simply let her work. Later that afternoon, a military officer returned to the hospital. Everyone noticed him immediately. He walked to the nurse's station and asked for Clara Bennett. Clara came from room 6, calm as always. The officer smiled. Ranger made it through surgery. He's stable. A breath of relief passed through the staff. Clara closed her eyes for half a second. Good. He'll need rest, but the team said your stabilization gave him the chance he needed. Clara nodded, her expression controlled. Then the officer handed her something small. It was Ranger's spare service patch. He can't thank you himself yet, the officer said. But his unit wanted you to have this. Clara looked down at the patch in her hand. For the first time since anyone at St. Catherine's had known her, her eyes filled with tears. She held the patch carefully, like it weighed more than it should. Around her, the staff stood in silence, not because they were afraid, not because they were shocked, but because they finally understood. The nurse they had mocked was never weak. She had simply survived things they knew nothing about. Weeks later, Ranger returned to St. Catherine's for a short visit before going back to his unit's care program. This time, he walked through the front doors on steady legs, wearing his service vest proudly. The whole emergency department stopped. Ranger ignored everyone. He passed Dr. Hale. He passed Denise. He passed the residents, the security guards, and the nurses gathered near the station. Then he walked straight to Clara. She was standing beside a patient pant's bed, checking a chart. Ranger sat at her feet. Clara looked down. A soft smile touched her face. "Well," she said quietly. "Hello, soldier." Ranger leaned his head against her leg. No one laughed. No one whispered. No one questioned why the military dog had chosen the quiet nurse, because now they knew. Some heroes do not enter a room loudly. Some do not wear medals where others can see them. Some simply walk through hospital halls, double-check medication, speak gently to frightened patients, and carry a past heavy enough to make them kind instead of cruel. Clara Bennett never asked the staff to feel sorry for her. She never asked them to admire her. But from that day forward, whenever she entered the emergency room, people made space, not because she demanded it, because she had earned it. And every person at St. Catherine's remembered the day they laughed at a quiet nurse until a wounded military K9 showed them who she really was.